What is an overbite? Now, an overbite is a situation where the top teeth sit far in front of the bottom teeth. Now, the issue with this is that it can cause a number of problems. For example, the teeth can't bite down properly. It can also cause crowding of the teeth. It can also even cause the teeth to chip and wear if the overlap is excessive. So there's a number of reasons why it's something that you should look into maybe correcting, especially if it bothers you from an aesthetic perspective. So can composite bonding fix an overbite? It's a very good question. However, in most cases where there is a large overbite, composite bonding can actually make things worse. The reason for this is because if you're adding a further layer to the top teeth which are already set forwards, it's probably going to make the teeth look more bulky and make the overbite more and more obvious. So it's probably something you don't want to do if you've got an overbite unless the overbite is firstly fixed. So what causes an overbite? It's a very good question. Now, one of the main reasons we have an overbite is because the lower jaw is just a lot smaller than the top jaw. Now, the consequence of this is that the bottom teeth will sit further back in front of the top teeth. And this is the reason why sometimes you might find that there can be a big discrepancy between the top and bottom teeth when you're biting down if you have an overbite. So, do I have an overbite, and how do I know if I have an overbite? Everyone ideally should have an overlap between the top and bottom teeth. So the top teeth should sit in front of the bottom teeth. That is quite normal. Anything above 4 to 5 millimeters of a gap between the top and bottom teeth is considered out of the normal range. Now, how would you know if that is the case? How would you know without measuring it? How do I measure it? Now, some of the symptoms you might find is that your top teeth may chip and wear. You might find that when you're sitting watching TV, for example, you can't fully close your mouth, when you close your lips when you're speaking and eating and drinking. Another thing you might notice is that when you're sat there, your bottom lip sometimes can sit behind your front teeth. And in those types of cases, we would try and recommend that the overbite be fixed because it can cause other problems going forwards. Is an overbite bad? Now, so the top teeth should overlap the bottom teeth. This enables them to bite through food, and your front teeth, called incisors, can then act like scissors and cut through food. Now, if this overlap is excessive, where the top teeth are set far forwards, then this can cause a problem with the bite. So for that reason, it might be something that you want to consider correcting. The other reason may be because the teeth are chipping and wearing because of this. The other thing you may notice is that your top lip is set far forwards, and you may not be able to fully close your mouth, either when you're sort of sat watching TV or at rest, or if you're eating or drinking or speaking to somebody.